30-year-old man presents to the emergency department after vomiting blood an hour ago. He says this happens to him occasionally, but denies feeling pain in these episodes. The man is disheveled and has slurred speech as he describes his symptoms. He is reluctant to give further history and wants immediate treatment of his condition. Upon examination, the patient has evidence of tortuous veins visible on his abdomen, plus a yellow tinge to his sclera. He suddenly begins vomiting copious amounts of blood and soon becomes unresponsive. His blood pressure drops to 70/40 millimeter mercury. He is given 3 units of whole blood but passes away shortly after the incident. Which of the following was the most likely cause at an hour ago? So, which of the following is the most likely cause of his vomiting of blood? Once again, most of you got this right, which is great. So, it is increased pressure in the distal esophageal vein due to increased pressure in the left gastric vein. Essentially, they're talking about esophageal varices. Okay. So it's a bleed, it's hematemesis coming from esophageal varices. So any question that you see, okay, any question stem on the exam where you see that mentions something about a man being, disheveled and he's having slurred, that's not the thing I wanted, having slurred speech, automatically think of someone who is homeless and immediately associate that with alcoholic, okay? Most questions where they expect you to, kind of derive that the patient is alcoholic and, they'll mention this definitely. I can think of a few other examples where they'll mention this for you to correlate that it's alcoholism. Okay, that's the underlying cause. So sometimes they'll talk about a homeless man, okay, and they'll expect you to correlate alcoholism and hypothermia, but that will be evident even with the temperature, okay? They might have mentioned temperature of 35 or 34 degrees Celsius. Another one is patient presenting with acute epigastric pain radiating to the back. That is immediately think of, acute pancreatitis, once again because of alcoholism. So just remember that anytime they say disheveled, slurred speech, okay, or even they mention that he's homeless, think of alcoholism as the root cause, okay? Since in this case, they've mentioned, upon examination that he has evidence of tortuous veins visible on his abdomen, plus yellowish tinge to sclera, points towards, this patient is having jaundice as well as caput medicae. So, it's, okay, a case of cirrhosis resulting in portal hypertension. So, the way it goes is alcoholism resulting in cirrhosis, portal hypertension, esophageal varices resulting in bleeding. Okay. So when you look at the other options, okay, it can get a little confusing, especially with respect to the second option, which is lacerations of the mucosa at the gastroesophageal junction. This is known as Mallory-Weiss tear. Okay, it's usually only a superficial laceration. The way you differentiate both, because both do occur in alcoholics, okay? Mallory-Weiss tear also happens, most commonly in people who retch a lot, especially, alcoholics. So the way you differentiate both is, there's two main points that I would say is important. The first being in the case of esophageal varicose bleeding, it's going to be a massive amount of blood, okay, blood loss. Whereas in the case of Mallory-Weiss, there is hematemesis, but it's not as massive. As you can see in this question, it says begins vomiting copious amounts of blood. And also you can see the hemodynamic instability. It says blood pressure immediately drops to 70/40 and even 3 units of whole blood could not save him, okay? So that just points towards how severe the hemorrhage was, okay? Like I mentioned, whereas in this second Mallory-Weiss tear, it's not as severe. Moreover, in the case of esophageal bleeding, it's painless, okay? It's mentioned, I think, in the second line, he denies feeling pain in these episodes. They're talking about past bleeds, but you can just correlate that even with this particular situation. So it will be painless. So just remember, massive painless bleeding, just think of esophageal varices, okay? Don't have to think of anything else. If they mention pain on bleeding, think of Mallory-Weiss tear, okay? Because that in that case, it would be a painful hematemesis, okay? Perforation of the gastric mucosa. This happens when the patient has a peptic ulcer disease, resulting in a gastric or duodenal ulcer, resulting in perforation. This can also cause hematemesis. It is one cause, but if they're expecting you to know that it is due to peptic ulcer disease, they might kind of also mention melena, okay? They will definitely mention, black tarry stools, just because, upper GI bleed results in hematemesis as well as melena. So they will mention that. Even if they haven't, they'll mention with the patient presenting, with a past history of ulcer or just, sort of, deep epigastric pain. But now he's presenting with an acute severe pain. So that automatically means, perforation. If they give you an X-ray or something, that's great, because you will be able to see pneumoperitoneum, which is basically air, under the diaphragm. So that'll be very clearly seen. Okay. Option D is decreased GABA activity due to downregulation of receptors. Here they're just talking about alcohol withdrawal. So like I mentioned from the question stem, you know that the patient is alcoholic, but he does not show any of the signs of alcoholic withdrawal, which usually are, anxiety or tachycardia or sweating or, seizures or delirium tremens. These come slightly later, but even otherwise, you just need to know that this is not alcohol withdrawal. Last one is inflammation of the portal tract due to chronic viral illness. So portal hypertension can result from a chronic viral illness, especially hepatitis B, C, because both of them result in cirrhosis that can also result in this. But in this, they've not mentioned anything about the patient, having hepatitis. Usually, if they expect you to think of hepatitis, they'll definitely have mentioned the hepatitis panel. Okay, they would have mentioned all the different markers that you would have observed in the serum and whether it's positive or negative. And yeah, like I mentioned, in this case, because I mentioned he's disheveled and he has a slurred speech, think of alcoholism as the cause of cirrhosis and not, viral hepatitis. Though it is a cause, in this case, it just doesn't, fit the scenario. Okay. So yeah. Oh, one more thing I wanted to mention is, in addition to like Mallory Weiss there, you will come across something else called Boerhaave syndrome. Okay, which is because of esophageal rupture, and this is also very common in alcoholics as well as bulimics. Basically, people who throw up a lot. Okay, but that would not present like this. Basically, they'll present with sort of an excruciating pain. And in addition, you will have what is known as Hammond sign, which is subcutaneous, emphysema. So you can hear like crunchy sounds all over the chest area where the rupture has taken place. So then just saying that's another like differential diagnosis, not for hematemesis, but I'm just telling with respect to, esophagus. It comes in one of those, like all the different disorders related to the esophagus, just one of them. So I just thought I'd mention that because like I mentioned, it is very common in alcoholics as well. Yeah, Mallory, so yeah, okay. Yellow tin sclera points towards, yeah, it does point towards jaundice. Yeah, it does. That's why they mention it, because they just want you to correlate that it has something to do with, cirrhosis. So they mention caput mendicae as well as jaundice. Okay. And if you want to know the reason for why they've mentioned jaundice, is just because cirrhosis ultimately means, the patient has gone for, end stage liver disease or even decompensated liver disease, which is like a step ahead of that. So in that particular case, any sort of, you can categorize jaundice as, pre-hepatic, hepatic, post-hepatic. So this is one of the causes of hepatic, okay, because of which you'll have elevation of both unconjugated as well as conjugated bilirubin. It's not, just one of them, it's both. So that's the reason they're presenting with jaundice, because of elevation of bilirubin. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.